The relevance of this big opioid survey study for the EAPC is certainly to have been able to set a practically world agenda of one basic fundamental issue of cancer care and palliative care in general, which is the availability and the access of patients to opioids. What surprised me more about the international data is probably the fact that notwithstanding decades now of the recognition that morphine is an essential drug for at least advanced cancer patients, but for many others who are suffering of untreatable diseases, and of the WHO campaign, which was now done at least 30 years ago on the dissemination of an approach to treat cancer pain, of the dissemination of the use of morphine and other opioids, we still see how difficult it is to get appropriate opioid medications in so many countries around the world. I think that this reflects also the fact that pain management and palliative care are set at a very low priorities in healthcare in general, and this is obviously more severe situation in those patients where healthcare has to be much improved, probably, or at least made more general in its approach. The main barriers I see probably contributing to this situation in some of these countries have to do with a double set of factors. One, as we said, is a sort of low priority of pain palliative care in general from the healthcare system in the world. And second is the stigma which is associated with the use of opioids, the misuse and the objective situation that opioids are of course abused and source of national and international crime, and therefore need to be controlled, and on the top of this probably culturally specific aspect which has to deal with the priority of controlling pain as a human right or as a possibility, even a possibility from a medical point of view. I think it's a matter of education, it's a matter of tackling culturally determined and locally typical situation as they are. We have to understand what it is, their understanding of pain, their understanding of a disease, their understanding of the help that they are able to ask for medicine and from medical treatment, and then to let them understand that there are other ways to do it and there are ways not to suffer or to appropriately use these drugs without interfering with specific cultural aspects of life. Certainly international data in some very big areas of the world are showing a worse picture than the European data. The European data show a relatively large availability of opioids across Europe, although in the larger area of Europe there are countries where this still needs to be improved, but certainly the picture is much more homogeneous, while for some of the countries in Asia, in Africa, certainly the situation is dramatic. There should be some ability to refer to world standards, to a world agenda, which implies the responsibility, of course, also of our own governments and our own scientific and medical communities to set the priority of palliative care and of pain management at a very high level in healthcare, in a way that also countries can measure themselves with this particular standards of care, which is pain control and palliative care. The impact of the availability of morphine and the appropriate use of morphine in appropriate cancer care has been changing quality of life of thousands of, probably hundreds of thousands of patients in Europe. I mean, we already have the example that there are so many patients, in particular in countries where even cancer treatment is less available. Because if the control of cancer is not available with the active antineoplastic treatments because of local situations, and morphine and opioids are much less expensive and much easier to be made available. Probably at least some of these people would have relief of suffering where they cannot have appropriate cancer control. It is a general achievement that with different levels of development, palliative care is a recognized discipline in medicine and healthcare at the national and the international level within the cancer community. And I think that ESMO, being representing such an enormous amount of the knowledge and the professional skills which are around cancer, has to collaborate with the EAPC, and the same is true for EAPC.